Stan was out working for Russ.
Really?
Support that.
And
Good dog. Very good. You doing? It's good to have Eric here.
Yeah, I really love being here.
On the spot.
technical support.
Much needed. It's like a library or a church in here. What's going on? Oh my goodness. First base and left hand pitcher, so we're going to be in West Virginia University this weekend. I mean, it's hard to push it in because he loves it, but once you get to the cost on the other side, I know. So you're more valuable to come to the picture, so it just makes sense. They're letting them do both.
That is a critical need that's in that area due to the fact that has been some other medical facilities that have closed. And so we've been getting a lot of new patients, so we are expanding those services out there to add another physician to that area.
Okay. It would be really helpful if you could introduce yourself and your colleagues.
My name is Jennifer Allison. I am the practice manager of the Wayne Memorial Community Health Center's 4 pediatric offices.
I'm Gail Peterson. I am the practice manager for the Pike Family Health Center and the Clinical Family Health Center in Taft.
I'm Karen Arthur. I'm the office supervisor for Pike Family and the Tick-Borne Disease Wellness Center in Woods Valley.
I'm Tina Collins. I'm the office supervisor at Pike Down.
I'm Marina Deal. I'm public relations specialist, just kind of coordinated everyone. But just to let you know, we have one other office represented in Pike County. Unfortunately, it was one of our nurse midwives. She was not able to make it. So that's another one of our services.
Thank you very much. Photo with them now? Yep.
Photo time.
Photo time.
Thank you. I'll follow your cue.
Okay, right. What do we got here? If you could all maybe, yeah. One second, I need it.
No, you're fine.
It's your resume. I'll let you guys go in that.
Okay, thank you.
Thank you, everyone. You are welcome to stay or go back to work, whatever you do. Stay for a little bit, though.
Okay, so on that note, I was talking about medical. On our agenda at the end here, we had a Pike Medical Foundation check presentation from Senator Baker and Jeff Olsemer. So our efforts in the county have been going on now for a number of years. Give you everybody a little history on that. Back when the county was awarded or given some of the COVID money, we took $2 million of that money, knowing that we needed to start creating a medical foundation in this county so that we can so we could pursue expanding medical services in this county. So that fund sits now at the Greater Pike Foundation. There's some members here from that organization who hold that funds. Those funds are strictly going to be used for us to benefit a medical provider that can come into this community and hopefully build a hospital, because that's the goal here. We work on this. In fact, we were just on a call, a text, I'm going to say, or an email just a little while ago with members of the hospitals and some of the management company for them, just giving us some updates on it. So it is getting closer. It's a big, long slog, though. This is nothing that can happen easy, because if it was easy, Pike County would have had a hospital a long time ago. But things have changed, and we have very interested parties in doing this. So with that said, we put $2 million into this. We have a medical foundation board that a small group meets maybe monthly. We try our best as we have updates to give to them from the commissioner's office. But in that, we have also been trying to take this $2 million and add to it, because it's going to take more than that. There's a press release, I think, that's been circulated out to the press. To give you an idea, this is a $30 million project with numbers of partners in it, Pike County being one of them, not us being the owners of the hospital. I don't want people to think that the county's building a hospital that we're going to own. This is going to be us facilitating them to bring a hospital to the community. In pursuing this, we need to make sure that we can identify other funds for them. And through those efforts, Senator Baker and Jeff Olsemer were able to earmark to us and give us, not just earmark, give us a $500,000 grant, which has been added to the Greater Pike Community Foundation now, which now brings us to $2.5 million. It's going to be every dollar that we can find to add to this, so that we can make sure that this is a viable hospital for this community. Sure that it is. So we have Senator Baker here, we have Jeff Olsemer here. We want to thank them for the check. I don't know if the Senator will give the Senator a moment to speak about this. And if Mr. Olsemer, and I know we have Rick Little from Greater Pike Community Foundation to give us a little update. Charlie Gillender is here. He is also on the Medical Foundation, as the three of us are also. So, Ron, if you have anything, or Krista, I don't want to.
No, just that it is and remains our #1 priority. And again, I think it's very good to have Wayne Memorial represented here today, because they do services, but we can never have enough, as you're very well aware. And Pike County, when I grew up here, there was 18,000 people, and now there is 60,000 plus, but that number doubles and triples during the season. And that season is for the most part right now. So it's a very challenging thing to meet the people's needs here in Pike County, and it is our #1 priority. It will remain our #1 priority until we have urgent cares up and running and we have a hospital up and running. So, my 2 cents.
And if I could just add to that, because in the press release it talks about what we've done to improve medical services. A number of years ago, many of you that are residents here saw the crisis that was occurring with our EMS services. We saw that going on, and And while it is, and I've said this many times here, it's not the responsibility of the county commissioners to provide EMS services, it's our municipal leaders. But at the same time, they don't have the abilities nor the funds to be able to do it all on their own. And to me, ambulance services, and I know my other commissioners agree, this is a piece of infrastructure in the county. We have to make sure that we have ambulance services throughout the county, not just in sections that have to then, other smaller areas have to be dependent for long distance travel. So we took $2 million worth of your taxpayer money, and we put up a grant fund now where we match dollar for dollar for every single municipality who puts up to 2 mils of taxes into EMS services. That has proven to be extremely beneficial to the ambulance services throughout. We have the supervisors from Lehman Township, and I know they can speak to this, that helped them, assisted them in creating an ambulance service in the southern part of the county. It's not just us, it was them though too. But when we get to a hospital and we think about it, that solved the EMS issue with ambulances being on the road, but it doesn't solve this. When an ambulance picks up people in the middle of this county, they are 2 to 3 hours out of service. That's a large stress on that EMS services, but that's why we need to have such a robust EMS service, because at any given day, some catastrophe could occur where we need all of these ambulances in service. A big accident on 84 could cause 6 or 7 ambulances to have to respond. But by having so many in service, even if they have to come from long distances, at least they're in service. But back to the hospital, that is why it would be important for us to be able to locate a small micro hospital, and that's, I think it's important that we call it that. We're not building a medical arts building, so that those ambulances would have someplace closer to get to from many areas of this county. So that is the other reason to do this, because then maybe the resources that are tied into EMS could be used other places. I'm not saying we're going to cut ambulances. I'm just saying that then there can be maybe a little bit more efficiency in how we have to do it. But right now, the EMS issue or the crisis that was occurring is solved for the most part. We have ambulances all over the county, and that is a really good thing. But these funds that we're going to hear from the senator in a moment about are going to help us address that and further down the road with a bigger medical provider for our community, for the seniors. That's the other thing, is we have a large population of seniors in our county who need medical services closer to their home than where they're located now. Senator? With that.
Good morning, everyone. Thank you so much. I'm honored to be here and want to express my thanks to the commissioners, because the key to solving this is local leadership, and I have to commend all of the commissioners for your work. This has been an ongoing process for many years, and I'm proud to partner with you, with Representative Olsemer, with residents, with employers, with healthcare practitioners, with visitors. And really what we're doing is to create a locally driven and establish a micro hospital. So we are putting in place the building blocks to provide access to care right here close to home, as Commissioner Osterberg said. And I have to say, we have been meeting now for a long time, and it's important for the residents to know that we've met with the Department of Health, the Department of Human Services, the Governor's Office, the Governor's Deputy Chief of Staff for Healthcare. We've met with the Governor's Regional Director for Northeastern Pennsylvania. We've worked with local elected officials. Jeff and I are here. There are other representatives. Tara Probst represents Pike County as well. So this is a priority for us. And what I can say is this $500,000 grant is a sizable grant, and it's a cornerstone achievement to this collaboration and partnership, and a demonstration of effective advocacy at the local level. And I'm honored to be here to announce the grant, to say that this is what I consider the first installment. I know that we are going to need to work together. There will be infrastructure needs, there will be medical equipment needs, there will be all sorts of things to bring about a hospital here. And this is the first step, but it's the cornerstone step. We know that Wayne Memorial has done a great job. Our community health centers are an integral part of providing access to care, but we do need a hospital. Been working similarly in Wyoming County. For a long time, Pike County was the only county with no hospital. Wyoming County lost their hospital because for-profit entity closed the building. And now we have a similarly driven local initiative in Wyoming County. These will be solved because of the advocacy, the commitment, and the dedication. And I'm proud to stand with you to partner. I look forward to putting a shovel in the ground because I know how difficult it is. I hear from constituents, Charlie, all the time, who are in touch, who are concerned, who worry about getting in an ambulance and having an hour trip to Scranton or heading down into Lehigh Valley. That is a concern. Access to quality health care close to home improves health status and outcomes for our residents. And quite frankly, it's the vitality for our economic development, for our tourism industry, and for our residents to have that. So pleased to be on your hard work. We're glad to partner with you, and I'm delighted to turn it over to my friend and colleague, Jeff Olsemer, for some comments as well. Thank you.
Thank you, Senator Baker, and Commissioners, thank you for having us here today. It's an honor to be here, and I'd like to say first and foremost, it was an honor for me to participate and be a board member on the Wayne Memorial Health Foundation board for many years, and just say what a great organization that you folks have, and what a great thing you've done for Wayne County, Pike County, and the region. So the resolution is well deserved, and congratulations. I can't say it any better than what Senator Baker said. Really, she wrapped it all up quite well. But what I would say is that when I got in, the hospital had already gained some momentum, and I heard that pretty much right away. The commissioners have worked steadfast on this, and it really, as Senator Baker said, it really is driven by their passion for wanting to bring a micro hospital to the residents of Pike County, and through their efforts has inspired folks like myself and Senator Baker to work as hard as we can to help deliver on what they see as a big delivery for health Pike County and all across Pennsylvania and the United States for that matter. Rural healthcare is a significant issue. This is a great opportunity, and this is a start, and there's still a long way to go, and we recognize that. And we're here to support you and your endeavors, and the people of Pike County as well. Thank you.
Thank you.
Go ahead.
While we certainly don't always agree on everything, we certainly agree on this, that having Pike residents have access to quality health care should be a right. It should not be a question. And I commend the work that these two gentlemen have done before I joined them in making that a reality. And I just want to assure people that that work is ongoing. It is not a rumor. This is something that we are aggressively moving towards to the best of our ability. And I do credit the leadership of Senator Baker. Thank you, because I've heard a million times, she's on the phone, we got her the thing, she's on the Zoom. You're always accessible, and you understand this county and this room when it comes to providing healthcare to our residents. Also want to credit Little and the good folks from Greater Pike for stewarding, properly stewarding the funds that we place in your hands to make sure that this is a reality. So that was pretty much all I wanted to say.
Rick, did you have anything you would like to add?
I'll be brief. Good morning, everyone. I'm Rick Little. I'm the Executive Director at Greater Pike Community Foundation, and I'm joined here by one of our board members, Jackie Damien, who's joining us this morning. And I just want to say thank you to the Senator, to the Representative, and to our Commissioners for your commitment to making this dream of a hospital reality, and a commitment to the health and well-being of all the residents of Pike County on behalf of Greater Pike Community Foundation. And we look forward to continuing to partner with the Commissioners and our local leadership to bring this hospital to reality. So thank you all.
Thank you, Rick.
We hope it's not the first and only check.
We do too.
I'll take you up on that.
So I would be remiss, though, not to mention this. So if there's anybody in this room or anybody that's going to be listening to this, we're always open for donations. And it's in the press release where you can go to PikeCommunityFoundation.org and fund and help us fund this hospital. Some people have, and it's very well received when we get that. So, because this is going to take a community effort to have this happen. And as I say, this is very important to everybody that's sitting in this room and everybody in this county. So read the press release, and if you have a checkbook, write a check. Okay. We'll do a picture. Well, I was going to first say, is there any questions for the press on this? Because I'm not sure they're going to stick around for the rest of the meeting. Is there any questions from the press or public?
Fred Weber, Milford. Couple of questions. Well, first to say, being a fragile senior, I'm really glad to see that you're focusing on healthcare because I need it. The other question, facility.
It's all fully built out. If you walked in there tomorrow, you would think it was open. They are dealing with, as I've said many times on this, they're dealing with insurance issues. I believe that they have a doctor now, but the whole process of getting certified to make sure that they accept all the needed insurance in the community is a bit of a job. We just talked to them probably. We're as anxious as everybody else to see that get open, but if you went there and opened the door, you'd see it looked like it should be open. But that is the sticking point right now and I have to say, and I've talked to them a couple of times about it, they don't want to open and then have somebody go in there and all of a sudden they don't accept their insurance, because that will just resonate in the community as a black eye, right? Oh, they opened this thing up and they don't take our insurance. So it is a process. It seems like it should not be that difficult of a process, but it is. And they're working diligently at it.
Yeah, and I'll add that the one up by me at Lake Wallenpaupack, close to the high school, if you were to drive by there, you probably did at some point, is significantly moving along. And I was with the owner last night, and the interesting thing is, and they're both Northwell facilities, and we can say that. They're fully invested in bringing healthcare to our community, but the fit out is cost more than the building and development itself. So that's a very interesting comment because of all of the equipment that is going inside of these modern new facilities. It's a beautiful facility, 2,500 square feet of an urgent care that will be first class and first rate. And that is under roof. The stone is on, the siding is on, they're working on the inside. The HVAC is being worked on. Each individual room is going to have its own system to create negative and positive pressures that are needed in the healthcare industry. So we're excited about both facilities opening up very soon.
I think it's important to mention there, though, they never requested the medical foundation funding. All of that is being done outside of the medical foundation. They did not ask for any funding for this. When this all started in the beginning is when we had put this money into this fund, and they told us, this is Northwell, we don't want that money. You use that money to build out and create this hospital much needed. We'll handle, these are our responsibilities. So I just want everybody to be clear. This $2.5 million, none of this is going towards either one of those urgent cares. That says a lot to me about Northwell being committed to this community because we did offer it in the beginning, because we weren't even thinking about a medical hospital at that time. We were thinking more about urgent cares, and we were trying to make sure that they were successful with that. They're feeling they will be successful without our help on the urgent care side. So, okay. Anyone else? Picture time. Yeah, Charlie. Yeah, Charlie. The senator asked you to do that. Sure. Hi, Jackie.
Yeah, do we need to get up and move over?
We need to slide this way. Get closer.
Yeah, you usually
I
go
know the
back.
tilt in, yeah.
Go ahead.
I'm gonna ask you to stay so I can get one for the county.
They'll share.
Thank you.
Thanks.
I'm just.
Thanks,
Thanks, Rob.
Commissioners, thank you.
Thank you, I know that.
Offset the
We're gonna move on to our regularly
latest.
scheduled program here in a moment.
Thank you. Goodness, kind word.
Thank you. Thanks, Jeff. Nice to see you, Carolyn. See you, Mark. See you, Paul, I'm sure. Okay. Let's go to personnel. Motion to hire Daniel Lapadula as a part-time facility assistant at the Pike County Training Center for less than 1,000 hours per year, effective August 11, 2025. On behalf of the Public Safety Department, this is a replacement position.
Motion.
Second.
Motion second, all in favor? Aye. Motion to hire Suzanne Lee Gennaro as a full-time clerk in the Pathonetary's office for a 37.5-hour work week, effective August 13, 2025, pending successful drug screening with benefits after 90 days. This is a replacement position.
Motion.
Second.
Motion is second, all in favor?
Aye.
Motion to recess the Commissioners' meeting to hold a salary board meeting.
Motion.
Second.
Motion is second, all in favor?
Aye.
Salary board, motion to convene the salary board.
Motion.
Second.
Motion is second, all in favor?
Aye.
Motion to approve the July 16, 2025 salary board minutes.
Motion.
Second.
Motion is second, all in favor?
Aye.
Motion to approve the July 23rd, 2025 salary board minutes.
Motion.
Second.
Motion is second, all in favor?
Aye.
Motion to approve the July 30th, 2025 salary board minutes. I'll make that motion.
They abstain.
Second.
Motion is second, all in favor?
Aye.
Motion to set the hourly rate of Daniel Lapadula at $15 per hour as a part-time facility assistant at the Pike County Training Center for less than 1,000 hours per year, effective August 11, 2025, on behalf of the Public Safety Department.
Motion.
Second.
Motion is second, all in favor?
Aye.
Motion to set the hourly rate of Suzanne Lee Gennaro at $12.75 per hour as a full-time clerk in the Pathonetary's office for a 37.5-hour work week, effective August 13, 2025, pending successful drug screening with benefits after 90 days.
Motion.
Second.
Motion is second, all in favor? Aye. Motion to set the hourly rate of Richard Conklin and John Green at $37.14 per hour, retroactive to July 28, 2025, due to the terms of the agreement between Pike County and AFSCME District Council 87 for the completion of 8 or more years of correctional experience.
Motion.
Second.
Motion is second, all in favor?
Aye.
Motion to set the hourly rate of Romeo Florent and Russell Tagliarini at $29.26 per hour, effective August 12, 2025, due to the terms of the agreement between Pike County and the AFSCME District Council 87 for the completion of 1 year of service as correctional officers for the correctional facility.
Motion.
Second.
Motion is second, all in favor?
Aye.
Motion to set the hourly rate of Emmanuel Fletcher Green at $36.64 per hour, effective August 14, 2025, due to the terms of the agreement between Pike County and AFSCME District Council 87 for the completion of 2 years of service as a correctional officer for the correctional facility.
It's $32.60.
What did I say?
36.
Sorry, $32.64 an hour.
Motion.
Second.
Motion is second, all in favor?
Aye.
Motion to adjourn the salary board.
Motion.
Second.
Motion is second, all in favor? Motion to reconvene the Commissioners meeting.
Motion.
Second.
Motion is second, all in favor? Old business, motion to award bids for the coordinating and providing effective service delivery to eligible older adults and disabled persons in Pike County on behalf of the Area Agency on Aging as follows.
Motion.
Second.
Well,
No.
read them. Traditional Home Care LLC, $22 hourly for personal care. Sinclair's Home Care, $26 hourly, personal care, $24 an hour. Home Support. Valley Home Care, $25 per hour, hourly, personal care. Above the Rest, New Jersey LLC, $26 hourly, personal care. Donkey Home Care Agency, $20.25 hourly, personal care. Caregivers of America, $21 hourly, personal care, $22 hourly, personal care availability rate. That's it.
Motion.
Second.
Motion is second. All in favor? Okay, motion to open bid for the 2025-26 annual beverage bid on behalf of the correctional facility.
Motion.
Second.
Motion is second, all in favor? Aye.
We only have one bid, it is for Bernard Foods, which is a little unusual. Total bid, $5,573.
Okay, I have a motion that we table the awarding of the bid until our August 20th meeting. Motion.
Second.
Motion is second, all in favor?
Aye.
Number 3, motion to advertise bids for the triannual groceries and frozen foods bid for the period of November 1st, 2025 through February 28th, 2025 on behalf of the correctional facility. Motion.
Second.
Should that say 2026?
Yes, it should.
Yeah, it should, thank you.
Thank you.
Otherwise,
Thank you. Mrs. Auditor, very
you're
good.
welcome. I'm a numbers person.
Okay, with that correction, motion. Motion.
Second.
All in favor?
Aye.
Motion to authorize the chairman to execute the contractor's application for payment from Knight Well Drilling in the amount of $9,837.31 for the Pike County Jail Complex Well Number 3 Drilling and Development Project.
Motion.
Second.
Motion is second, all in favor?
Aye.
Motion to authorize the chairman to execute the contractor's application for payment from E.R. Lindy Construction Corp. in the amount of $135,551.22 for the Bennett Avenue paving project.
Motion.
Second.
Motion is second, all in favor? Aye. Motion to authorize the chairman to execute the Chapter 105 water obstructions and encroachments general permit registration for Egypt Mills Road Bridge.
Motion.
Second.
Motion is second, all in favor? Aye. Okay, and in the business, we took care of that. Number 2, motion to approve the fiscal year 2025 first and second quarter payments from the Pike County Emergency Medical Services Matching Grant Fund to Blooming Grove Township in the amount of $68,475.05. Delaware Township in the amount of $107,500. Dingman Township in the amount of $174,400. Green Township in the amount of $16,528.60. Lackawaxen Township in the amount of $164,000. Lehman Township in the amount of $178,360.91. Matamoros Borough in the amount of $14,421. Milford Borough in the amount of $20,000. Milford Township in the amount of $30,000. Palmyra Township in the amount of $129,017.55. Porter Township in the amount of $16,457.04. Shahola Township in the amount of $49,000, and Westwall Township in the amount of $56,042.47.
Motion.
Second.
Motion is second. Any questions? All in favor? Aye. That is the money that has been earmarked, that has been sent out now for the EMS services, and you'll see it was for the first and second quarters. So that's the county's contribution to each one of those municipalities. Number 3, motion to approve the following human service payment vouchers on behalf of the Office of Human Services Fair in the amount of $2,000 and Emergency Rental Assistance Program 2.0 in the amount of $2,607.10.
Motion.
Second.
Motion is second. All in favor?
Aye.
Motion to approve the Pike County Home Program payment voucher payable to Freedom Mortgage in the amount of $2,423.71 on behalf of the Office of Human Services.
Motion.
Second.
Motion is second. All in favor? Aye. Motion to approve the Pike County Home Program payment voucher payable to First Energy in the amount of $483.28 on behalf of the Office of Human Services.
Motion.
Second.
Motion is second. All in favor? Aye. Motion to authorize the chairman to execute the following Delaware Run contract renewals on behalf of the Office of Human Services. Applications 50, 43, 64, 63, 65, 51, 55, 62, 45, 52, and 46.
Motion.
Motion is second. All in favor? Aye. Motion to authorize the chairman to execute the service quotation from Smith's Detection on behalf of the Sheriff's Office.
Motion.
Second.
Motion is second. All in favor? Aye. Motion to approve the reimbursement to the Pike County General Fund from the Gypsy Mill Fund in the amount of $156,209.50.
Motion.
Second.
Motion is second. All in favor? Okay, under miscellaneous, as every meeting with the Penn State Extension's calendar events for everyone's information, and then we move to press and public comment.
Yeah, this is, my name is Jesse Toshik. I'm here to express deep concern over the Pike County's ongoing use of bid for assets to conduct share sales, a decision that was never publicly debated, continues to lack transparency, and is now measurably costing the county revenue. Roughly a year ago, I attended a live share sale. I was informed directly by the sheriff that all future sales would be handled through bid for assets, an out-of-state for-profit company. Since then, I have personally spoke with the sheriff regarding numerous problems with the vendor, including financial risk, legal confusion, and a lack of buyer protections. I followed up with multiple emails and letters addressed to the sheriff, the solicitor, and you as the board. To date, I have not received a single response. The only informal comment I received was a vague statement that the county may be considering a different vendor, but that vendor has not been identified and no details have been disclosed. On July 4th, I submitted a right-to-know request seeking records related to the county's relationship with bid for assets, including contracts, correspondence, and approved documents. I was given a 30-day extension. That deadline is upon us and still no response. This is not only disappointing, it placed the county in violation of Pennsylvania's open records law. Even more concerning, in court yesterday, the sheriff's solicitor conceded that the 1.5% buyer premium charged by bid for assets, included on my own recent sale, is being paid out of the sheriff's statutory poundage. In my case, that meant $2,500 in public revenue was diverted from the county to a private vendor. And unless it is corrected, future sales will continue to do the same. In addition to the loss of revenue, some of the major problems with bid for assets I've sent to you, but I will go over them again, is unqualified buyers are winning auctions and are failing to complete the purchase. I've seen at least 4 failed closings in less than a year, when live in-person sales might see 1 failed per every 2 years or so. Platform invites inexperienced bidders with no follow-through. Buyer deposits are sent directly to bid for assets, which would be the entire purchase price. It's an out-of-state private company, and from what I've been told, there's no protection. So I'm sending bid for assets hundreds of thousands of dollars with no real guarantee that if they go out of business, that my money isn't just taken. The software platform itself is faulty. It does not function properly on common browsers like Safari, and using a cell phone is almost impossible for it. There's fees being charged that are not authorized by statute, including the 1.5% fee. So I'm just trying to understand, after 5 and 6 emails, why there's been no correspondence, no freedom of information of what was occurring. It seems like this was done without any knowledge of anyone, and I can't get one piece of information about it.
Jesse, they've asked me to respond to them, with the sheriff if he wants to clean anything up. First and foremost, I disagree with many of your accusations.
Which one do you disagree with?
Well, we'll go through them. But the first one is when you say it's not benefiting the property owners and or the company. Last year, the county, the owners, the people lost their properties. The total amount they received back between all of them was only about $83,710. By opening the bids to all the public and making it more open.
That information.
No, my turn. No, I listen to you. My turn. I didn't interrupt. The owners actually at this point, with only 7 received $440.
That information is not correct.
You're wrong. It is correct.
Okay.
How about I get to just talk for 5 minutes? Okay? Let's be honest with yourself. You're a constant bidder at the sheriff's sales, and you do very good at it. But what has happened is the county has the absolute right to open up the bidding to more people. We find that it's very successful by opening it through the process we're using. It's open to more individuals for bidding, more opportunities to have the banks not have to buy them back. The sheriff is making more money at it. And your comments about bid assets, we've listened. We have some issues, but the sheriff has decided, and we're going to sign the contract, to change to a new bidder starting in September.
And why would you do that? What was wrong with the other company? If you made such a good decision the first time, why are we changing?
Jesse, when are you going to let me talk first? You keep interrupting, which I did not with you, okay?
Because it's been a month and I haven't gotten
Mr.
one
Tashler, with all
correspondence.
due respect, please, we have to
That's-
remain respectful. We cannot do this.
That's incorrect, because I know the sheriff talked to you several times.
Once.
When you raised your issues and listened to you. I also have told the solicitor of the sheriff to respond to you so he would address it. And I spoke to the solicitor for the sheriff yesterday. All I was told is they bid for assets, waive your 1.5% on that particular bid.
That's not what was.
That's what well, I'm sorry, but if the solicitor.
It's coming out of the solicitors, it's coming out of the poundage that
No, the
was
sheriff
charged.
told me it was just being waived as he shakes his head. That's incorrect. Now, you may not like the system, but the system is benefiting the county and the owners of the property. We're gonna fine tune it. Everybody's starting, we're learning the process. We're
Who's the
seeing
first
what's
one? Who's the
best.
company? Can I at least know that information?
Once the contract's signed, sure, you get to know like everybody else. Once this contract's signed, it's a professional service, and then when the sheriff deems it appropriate, he can.
And is there a reason why I've gotten no information about when you signed up the initial one?
Well, you should have gotten the bid.
I should have. I haven't gotten one piece of information.
If that's what you're asking for and you're right
We'll
to
give you
know
the bid for
request,
asset contract. I don't know why you didn't get that.
I understand. It's been 40 days of waiting
Well,
for it.
No, we're still in the 30-day.
We're still in 30 days.
Today is the final day.
It is not, that's not
Well-
the way the law works.
Just so you know, that's incorrect. We have 30 days. We asked for 30 days, and we'll give it to you by the rules within 30 days. So as you keep trying to pontificate and keep saying we're making mistakes, I disagree with you.
Well-
And we listened to you politely as you made your whole spiel. I'm trying to give it back, and you keep interrupting. Okay?
Now's the time.
I understand you're a good businessman. You work hard. I applaud that. You do very well with sheriff sales. You're doing very well in making money. But the county gets to make money too. And we find that we find that it is benefiting the county, the owners, and we're having many more success in bidding by opening it up.
Okay.
And we're gonna continue to do that, and there's no prohibition against it.
Can I comment on that? Number
We're not
one.
gonna let the sheriff speak in a moment.
Now I'm gonna let the sheriff respond to your comments, okay? Sheriff?
Just briefly, I believe the deadline for the right to know request is August 14th. All relevant information will be provided to Mr. Tashlick by that time within the law, Pennsylvania right to know law. The company bid for assets, waived the fee, so that money did not come out of the county poundage. That is an inaccurate statement. The use of an online auction, which occurred prior to my taking office in February, has greatly improved the county's position and the unfortunate homeowners' positions. So, we think of these foreclosures. I see a lot of these foreclosures come through in estates, widows, people who have lost a spouse, widowers, that maybe don't know how to handle or overwhelmed by the situation of losing that person. And they wind up in this position where their house is foreclosed. As Attorney Farley indicated, we ran the numbers all of last year. We returned $83,000 to homeowners, which is money above and beyond what the bank needs to get their mortgage paid. This year so far, we've returned, I believe it's $414,000 to homeowners. These are Pike County residents. These are our neighbors who have lost their homes for whatever reason. Maybe a good decision, bad decision, whatever it was, they've lost their homes. So the county gets 1.5%. You just
The county gets 2%.
2%. You are correct. And bid for assets, a private company was charging 1.5%. Mr. Tashlick brought this to my attention, having taken office in February, and I immediately began to look at the situation. That being said, we have switched to a new company effective September due to advertising timelines. We couldn't do it any sooner. We have to advertise these sales for a certain amount of time before they can be done. So September sale, which I believe is the 17th of September, will be the first sale with a company called Real Auctions. That was discussed in the commissioners' meeting. That was put on the commissioners' agenda, publicly discussed, that was available to Mr. Tashlick or anyone else who wants to follow the commissioners, and they signed the contract for Real Auctions. The difference between Real Auction and bid for assets is that 1.5% They do not charge that. Real Auctions charges the bank a flat fee of $250 per auction. So there'll be no additional cost to a buyer, which should benefit Mr. Tashlick. And there's no loss in revenue if the auctions continue, as I believe they will, moving forward, generating more interest and more bids, higher bids. And we have had a plethora of bidders from throughout not only the country, but the Commonwealth, buying these homes that would not have easily had access to these homes in the past. So win, win, win all the way around for the county, for the sheriff's office, for our staff. They're not having to man a post over the site. We're not having to rent the hall and pay for that money. We didn't have to pay any auctioneers to come in. If that would be the case, I don't know that I would have been comfortable up there trying to auction them off myself. So we probably would have hired an auctioneer if we stayed in person. Would have been more money to the county. So at this point, we're completely within our rights, I believe, and it is a win-win-win for everybody involved.
Can I comment on that? Number one, I've been going to sheriff sales for 15 years. I've been tracking every single sale that has occurred for the last 15 years. This has absolutely nothing to do with the fact of homeowners getting money. Number one, first of all, of the sales that have occurred in the last 7 months, if you actually were tracking it properly, 4 of the buyers who bought that weren't in the area didn't go through with the transaction.
But that would happen, couldn't that happen here?
Yeah, wait a minute.
It's more likely.
Jesse, but then the second bidder steps in.
The second bidder did not step in on any of those sales. All 4 of the sales that the bidder was somebody's third party was the only person that bid. It then went to the bank. So the sale then was done improperly. Number 2.
No. You keep adding things that aren't correct. It wasn't done improperly. If the bidder isn't aware, the bidder has a right to decide to go forward or not. If they don't go forward, the next bidder, my answer is correct. The bank's the only other bidder. So it's not like they weren't the bidder. The bank always bids, and you know that. They bid cost.
I didn't say they would bid. That's not what I was saying.
Yes, you did. You said it was incorrect that it went to a bidder.
It was incorrectly done because of the party that didn't know what they were.
The bidder can make a bid. If it, and the second bidder
First of all,
gets it, in this case, it's the bank.
Can I get your formal, because I do track them. I do track them.
You're
The information,
the answers.
but it's not exaggerating. If you'd like, we can go through the bidders.
You know
It's
what?
the same exact
Jesse,
people who purchased them.
You forget to mention, I also did sheriff sales, as did my partner.
I understand,
for years.
Please, Mr.
In
Tashler.
response, in all those sheriff sales, it was you, maybe a couple of individuals.
And that's exactly what's happening now.
No, that's not accurate. We're getting all the bids
Can
coming through.
we have a meeting and show me this?
And 80% was always going back to the bank at costs. And that's
Because
why
the prices are up. Has nothing to do with the third party company. It has to do with the price. Well, but I track it. You're telling me information.
Jesse,
I will give you the buyers.
Jesse,
It's the
you know
same
what?
exact buyer.
I'm going to have Ron Boucher respond to your questions. We're going to give you your information. If you want to present anything to the sheriff, you did such a study to show that's not impacting. But with all due respect, from a neutral business standpoint for the county, so far the process is a winner for the county and the people who lose their homes.
So when you have a non-qualified bidder, that's a good process?
No. It's a bidder. If it's determined later to be unqualified, then the bidder behind that steps in. In your particular examples, it was the bank. Well, in my experience before this, it was always the bank 90% of the time.
So you'd rather have an unqualified bidder bid than a person that actually can bid? That's your statement?
My statement is how it took place. But before, bidders would only cherry pick the top few 3 that were worth doing, as you did. Every bidder did their research and homework. We now have more people getting involved, more people doing research, and more people willing
The reason the prices are selling for more money is because the market is stronger. Those
I
two
would
things.
disagree with that. The market is down across the area.
Right.
Every billboard has a reduced sign on it. The 2 things quickly.
Well, that's an interesting concept.
You have an opinion,
No,
I
we all
respect
do
your
that.
opinion.
Well, I mean, he's saying it's not incorrect.
Here's the bottom line. Are these numbers correct?
Every number.
I want to
Numbers
see those
correct.
numbers. Can I get?
That's your opinion.
That's your
If
opinion.
we have collected $414,000 for residents, who in this room doesn't think we should be doing that? And if we've collected an additional $120,000 compared to last year, all the sheriff sales only generated us $108. So you know what? I think the discussion is done. You file what you need to do. Send them the right to know. We have other things to do here without debating this. If you disagree with these numbers, you show us that we didn't collect.
I will, don't worry.
Yeah. So you're telling us that we didn't send $414,000?
I'm telling you
Yeah.
that the bidding has not changed, and it's the same people purchasing them. So by definition,
I don't
it
care
is
about
the same
people.
people.
I don't care about the
You're
people.
telling me it's third parties that are buying them. If it's the same purchase,
I just have a question, Mr. Chapman. What difference does it make how many bidders are bidding on a property?
it doesn't matter.
So then why do you keep
You can't.
raising that as an issue?
I'm raising it as an issue. What I'm raising is unqualified buyers.
Unqualified.
That's not up to you.
That's not up to
And that's
you.
also, and that's also the cost of doing business. Anytime there's a public auction, a person could default.
But it's not a public auction. That's
So what,
that's
it's a private auction?
It's not a public auction. It's a legal proceeding. First of all,
No, it's a public
It's a public
auction.
auction.
and a sheriff sale is not a legal proceeding.
But it's
Mr.
also a public
Farley?
auction.
Jesse, it's both. It's
Exactly.
public auction
So
for
it's
a legal
proceeding.
proceeding.
I understand,
It
so there's
doesn't
two
mean that
sides
we
to
do
it.
a foreclosure, so there's only 5 particular people that get to bid on properties each and every month.
That's not.
That's your way.
But that's you saying what it is. What you're,
That's what it was.
okay.
If
You're
it-
you're making an assumption.
I was here for them.
Yeah.
I was here for them.
when the market was down, where no one was
Jesse,
bidding on them.
Jesse,
Please, I mean,
I disagree with you.
well, you
But
can
the
disagree
market
on
right
that.
now, whatever your theory is, we disagree with you.
So now you're.
You can give us the information you
I will
want.
give you the
I
information.
do have one more question. Okay, so now we've switched to a different bidder. You raised the argument about the 1.5%, 2%. So now that's gone. So what is your issue now?
It's the same issue.
Which is?
You're not allowed to charge any additional fees based on the legality. You are.
Jesse, there are no additional fees other than the banks, and the banks are okay with it. So there's no
Wait,
additional.
where are you getting that the banks are okay with it?
They accept it because they know they're also going to get more bidders. Banks don't want the property.
Okay.
The amazing thing is we're not the only
No
county
bank
doing
wants
this.
the property.
I understand. That was the theory of what I heard when it first happened. And
No
there's been plenty of
bank
times
wants the
where just
property
because
back.
another county does it doesn't mean it's the right thing to do.
So you do
Nor
not
does it mean
participate?
it's the wrong thing to do.
So do you not participate in Monroe County bids, or anyone connected to you participate in Monroe County bidding?
What does that have to do?
That's a yes or no, Mr. Tashnik.
Yes, what does that have to do?
So then, if you are participating in auctions in Monroe County with the same company, why are you here screaming at us? With all due
Because
respect.
they use the same company.
No,
I understand that they're
so
coming
why-
next.
So then, why are you here
They're
screaming
coming
at us?
Because I'm asking for information that I've not
But why are you
received
not?
for
But
a
if
month.
you're actively going through the same company in a different county,
I'm not actively going.
I just asked you if you were.
I have a partner that has, but we have, again, this just happened yesterday. It will be happening, the case where they conceded the
So
fact.
how long have you and or your partner been doing business in Monroe County through Bid for Assets?
We've been doing it here too.
No, but how
We don't have a
long-
choice.
No, I understand, but how long have you or your partner been doing business, buying property through Monroe County using Bid for Assets?
I haven't bought one from Bid for Assets in Monroe County.
But your partner has, Jesse.
No, he has not. We go to the sale. There's a difference between going to the sale and actually purchasing one.
No, you haven't
We haven't
purchased
purchased.
it.
I've not purchased one in Monroe County, no.
Nor your partner.
Nor my partner.
Just in closing, two last issues. I spoke to my solicitor, Ron Boucher, yesterday. He said he's spoken to Mr. Tashlik 12 times on the phone, so he is having constant communication.
And he told me that he has nothing to do with it. That's what he told me.
Secondly, and lastly,
Okay.
to address the issue of any buyer that may not properly follow through, I make the decision at that point to ban them from access to the platform if they're not following our rules, and they will not be allowed to.
And how do you
that, and that person will be off the platform.
How would you ban them? It's an email address. You can make up a different thing and you can go right back onto this thing.
That's
Your
all.
name, thank you.
It's not by your name.
So they purchased through an email, Mr. Tashlik?
They purchased,
legal name?
exactly, that's how they purchased it.
Correct, so
And
if
you can
that's.
put the deed in any name you want, so there's no way to
That will be up
know.
to the sheriff to determine how he will regulate that, and I'm sure they'll figure it out. Okay, next on pest and public comment.
Well, this should be easy. Okay, so at the last meeting, I asked, we talked about restoring the star.
Yep.
And you mentioned that you had, I don't know, either engaged or doing something with John Donahue
We are.
Which is kind of sarcastic, but we'll skip that part. So what exactly is this function? What exactly is he doing for you guys?
He's helping us manage a process through both SHPO and the National Park to be able to reestablish it. As I told you at the last meeting, we were contacted, I know that your group contacted the congressman asked the commissioner's office if we would at least step in and do it, so that's what we've done. And in fact, today I'm going to be speaking with Mr. Donahue about what the process will be. And then once that process is laid out, it'll be shared with everybody.
Okay, so is Mr. Donahue being paid or his consulting company?
No.
So he's doing this gratis?
He is.
Okay. And why do you think it was a good idea for you to take this over? When we had local residents involved and we were going to do this via contributions, we were working with the Lions Club, the Rotary Club, all the things you mentioned last time were in place. So why did you just accept it and that's it?
Because the congressman asked us to. And he felt it was the easier way for him to process through this. The congressman sits at a pretty high level in the government for him to be fully involved, so he asked us to do it. And it's turned out that I've talked to Eamon Leidy, who's the director or the superintendent, and he agrees that it should be the county that pursues this, so that's where we're going.
Okay.
Thank you.
By the way, there'll be hats and T-shirts available that say "Save the Star." Watch for it. Okay. That's all we got left.
But
I was reading through some documents earlier at the voluntary. The commissioners were involved in some kind of suit that was settled with the minority auditor. I was wondering what kind of...
It was a lawsuit filed by the Democratic minority auditor asking on her own for specific documentation, whereas, as we argued with the court, and the court agreed, that they're a group of 3, and they must vote as a group, and the majority of the auditors can only ask for information, not one sole auditor on their own.
Okay. Is this a situation where the county was responsible for the just on one? Roughly how much did this cost the
She, in fairness, she went through her own attorney, so that her side was not paid by us, and I'm the solicitor of the county. I did all the work, and I'm paid on a salary. We tried to work with Ms. O'Leary ahead of time, but she seems to insist that she can just unilaterally ask for documents, and as solicitor for the county and to keep the status the way it's required, the commissioners allowed us to take this to the next level and stop it. And the judge agreed with this. If you place. Okay?
anyone else? Okay. Motion to adjourn. Motion.
Thank you, Sheriff.
You're welcome.
Sure.
So sorry.
Okay, no, that's fine.